Hi, welcome to BariNation, where we support the bariatric community with humor, humility, and honesty.
You've just tuned into a podcast that welcomes you into a community, a resource center, and a safe place that powers your journey towards personal wellness.
Our goal is you leave us today feeling hopeful, inspired, and ready to live your best bariatric life.
Hi, BariNation. Today we are thrilled to bring you a very special podcast episode that was recorded live at AdventHealth Central Florida. This is the first time BariNation has recorded in a real broadcast studio, and we know you are going to love it. AdventHealth Central Florida is a sponsor of BariNation, and we are in our second year of developing educational content with them. Jason sat down with Dr. Baglu and Dr. SADI-S to better understand the bariatric patient process. Who qualifies for surgery, and why is it the most effective treatment for the disease of obesity? They were also able to tour the Celebration and Orlando campuses to see how AdventHealth Central Florida helps the human spirit thrive. Everywhere they went, they saw how much time and attention went into ensuring that every patient feels seen, heard, and valued. AdventHealth Central Florida is a BariNation practice partner, and we are so grateful to AdventHealth Central Florida for their continued support. Any bariatric patient of theirs can join our BariNation community at a special rate of $29 a month. Click the link in the description of this episode to learn more about this amazing opportunity. Let's dive into this very special episode.
Hey guys, we're so excited to be coming to you today. We're going to be talking with AdventHealth's surgeons, Dr. SADI-S and Dr. Baglu, and today we're going to be breaking down the nuts and bolts of bariatric surgery.
Thank you so much for joining us.
Thank you for having me. This is great.
Yeah, this is wonderful. So I'm going to dive right in.
Sure.
Who qualifies for bariatric surgery?
Well, so the exciting news about that is that the candidacy criteria is expanding, right? So it used to be that you had to have a BMI of 40 or 35 with medical problems, but so much information has come out talking about the benefits of the operations of the weight loss, the diabetes resolution, the improvements in fertility, the lower risk of certain cancers, right? That our societies have endorsed now a BMI of 35 without medical problems and a BMI of 30 with medical problems. So this is kind of the new criteria that we have adopted, and we're able to help more people and reach more patients. So this is very exciting news for us.
So we're learning a lot about the AdventHealth whole person approach to overall wellness. Mm-hmm. Do non-bariatric providers speak and communicate with the bariatric providers? How does that intertwine?
Sure, yeah. I think that's a very important part of how we take care of patients. When you first meet your bariatric surgeon, we're just getting a tiny glimpse into your history, whereas your primary care provider or your endocrinologist or your cardiologist knows much more about you than we do. So that communication, I feel, is really very important. I communicate directly back to those physicians every time I see any of my patients, both before and after surgery, because especially afterwards, that evolution, you want to make sure they're aware of what's happening. If there's things that need to be modified from a medical perspective, you want to have that team approach. They all have my cell phone so that they can reach out at any point, right? So it doesn't matter if I'm on vacation or if I'm in the OR, you're always going to be able to get a hold of me. And I think that interaction is really key to being able to take care of patients.
Absolutely.
I love it.
Mm-hmm.
All right. We want to get a little bit in depth about why and how bariatric surgery works.
So the beauty of bariatric surgery is that we're still learning about it, right? And so the concept that you're just eating less and that's why you're losing the weight, well, I think we've proven that to be inaccurate, right? There are gut hormones that change immediately after surgery. And the way I tell it to my patients is those hormones that fight you when you go on a diet, those are the hormones that are now working with you to achieve this new metabolic set point that we're trying to kind of attain, right? And so it has a lot more to do with just eating less. That's just a small portion of this. The gut hormone change, that chemical milieu that changes in the body, I think that is the key component of what the operations can offer.
Absolutely. And that It's baffling to us as patients that we still hear a lot about just eat less, move more, calorie deficit, right? And I think we're in 2025. We're learning all of this about bariatric health and medicine. Why do you think that diet and exercise are still kind of pushed on folks with obesity?
Yeah. So, that's kind of the stigma that's always been out there, right? And as you know, in every part of life, change is hard, right? And not everybody has access to the information that we do in the bariatric community and keep up with. So if you were going to ask me about the up and coming, technology for cardiology, I'm not going to know that in depth at all. I will know just generalities. And it's the same. This isn't mainstream information that's out there, right? And so if you're not someone that is heavily involved, even as a provider, right, you may not know the benefits of what we do from a surgical perspective. And that's one of the things that I think it's important as physicians to try to tell our colleagues, but even as patients, right? So why not, if you're seeing your doctor and you are aware of it, take them the article you read about how this operation is going to change things. And that will spark an interest, perhaps, right? And I think as a community as a whole, patients, doctors, therapists, right? If we want this to really become prevalent and lose that only about 1% of, bariatric patients actually get the care they need, right? Then we have to kind of scream this from, the tops of every building we can get on, right? And get everybody to listen.
Yeah, it's been one of the things that's been near and dear to our hearts since we've been post-op, and for Natalie, that's a long time.
Yes,
and it just is something that we it's so heartbreaking to hear the stories of people that I myself waited 5 years before I even had the surgery, knowing that I needed to, but pushed it off. I could do it myself with diet and exercise because that's what I'm told by the people that know better than I do, because I don't have a white coat with initials on it. I just don't. So for me to sit there and think that I know how to do, so I listen to the people that I think, would know, and, continuing to do that and then shaming myself for not being able to do it. And, then you start the whole spiral and all those things. It's great to finally have a voice to talk about that and speak out and get more people to understand and on board with that.
Yeah. I mean, I love that about BariNation because I think, it has to be kind of like, look what we can do. This is exciting, right? We as bariatric surgeons have been doing this for quite some time, but, finally we're expanding the criteria, right, to give this to more people. I think people are starting to hear, right? And actually delve into those details, right? And I think we're seeing that long-term benefit. And it's been around long enough now that people can't really argue that, right? That, this doesn't work. And I don't know how many times I've heard that from just general people talking about it when they find out that I'm a bariatric surgeon. And it's hard for me to hold myself back and be like, no, it does. It really does work, right?
And that's the problem is you hear people say, I only know somebody that did this 25 years ago and they had, this happened and they gained all their weight back, or my sister-in-law's baby cousin Tracy had this done and this is what happened.
Right.
And it just doesn't always work that way. And now I don't know anyone that doesn't know at least someone that has had the surgery, been successful, things are working. So all of that narrative shift is making a huge difference. And that's why I think it's really starting to, the axis is starting to shift, and I love that.
Yeah. I mean, I think before, most of what you were exposed to is maybe someone who struggled even though they've had a bariatric operation. But now you're hearing all the people that are saying, on social media, on their own personal platforms, right? Because you don't have that stigma that you can't talk about it anymore. Right. And so now they're saying, yeah, I did it. And look at me now. Right. And that's something that should be celebrated, and people should be proud that they've done this.
Absolutely. Absolutely. So with that being said, what types of bariatric surgery are performed at AdventHealth?
So we do the entire spectrum of the operations that are out there, from sleeve to bypass to duodenal switches to SADI-S and to revisional operations. I think that's an important kind of point of what we do, is that we can match what you need with you rather than just saying, I do sleeves, right? Or I do bypasses. And having, the ancillary support and and the colleagues that are vested in this, it just really creates that team approach to the whole you experience, so that it's not one, small team on the bariatric side alone that's trying to achieve this, right? So that's a key part of our program.
Well, that's one of the glaring things to me about AdventHealth and how amazing the program overall is. Like we, just in touring your Celebration campus, yesterday, it's one of those things that just shows how in depth you all go, how to make sure that every single point of this, every aspect of this is kind of well versed and taken care of, because like you had spoken about earlier, like every single department knows what the other department is doing. You guys have all this intermingling, conversations, and so it's impossible for somebody to not feel like they're the most taken care of in the AdventHealth system, because it's important for us to know that because the worst thing for someone is having to deal with this anyways, to get the courage up to do this, to have somebody tell, oh, well, now you got to do something else. Oh, we just need this one more appointment. Oh, well, you just have to explain this again, because I didn't really hear, getting us to explain it the first time is hard, because we don't even want to have that conversation with ourselves, let alone with a medical provider. So feeling like we're not listened to the first time is even worse. Now we're like, well, how much care could you possibly give me if you're not even listening to what I tell you the first time? Yeah. That is not the impression that we got when we were in the campus, or any of the AdventHealth professionals that we've spoken to. You all take extreme care and caution to make sure that everyone feels supported and listened to, and that's just amazing. Yeah, I mean, that's a big part of this, right? And I tell all the patients, it's a privilege to be able to be your surgeon, right? You get to choose your surgeon, right? And for a patient to choose me, then that means that I have to do right by you, right? So I have to look at everything. I have to know your medical history. I have to know your surgical history, right? I'd really like to know your goals so that I can help direct you. And ideally, what I want to do is recommend something that's going to help you from here on forward and address not just the weight, but your diabetes, if you have reflux, right? If you're trying to get pregnant and you can't, right? So what can I do to make sure that I help you achieve the life goals that you're trying to do, right? Which is different than any other kind of surgical practice, because it kind of brings in the overall health of the patient. Whereas, for example, if you're fixing a hernia, well, there's a lot of important parts to that you have to consider. But your life goals aren't really going to be a conversation that you have with that surgeon, right? Right. Absolutely. So if somebody's looking, like you had said, they get the option to choose the surgeon. So why would you suggest people choose AdventHealth? We're really dedicated to our patients. I am the newest member of our group, and I have been very impressed with seeing how my colleagues have taken care of patients and continue to do so. From, the nutrition side, from the medical side of things, there really is a very deep and concerted effort to be able to give patients the best possible experience they can have, right? And so to find an institution that's dedicated all of those resources and all of that support to really want to address this from a whole you perspective, I don't think you find that easily. So it's not just that you have one surgeon who's rallying for you. You have an institution, that's behind you. And that speaks volumes. I think one of the things we found that makes AdventHealth different from other programs, in touring the facility, we found that it wasn't as sterile of an environment as you would see in other hospitals. Like, it felt warm, welcoming, inviting. There was a lot of detail and a lot of thought that went into constructing this facility. And it's really awesome to see that patients get that experience before the clinical stuff happens. Like, I would rather be asleep before the clinical stuff happens. Like, I don't want to see the sterile stuff. You can keep that for behind the scenes. And that's exactly what we found when we were there. And I thought that was amazing. So how would you sum up the AdventHealth difference? So I think it's the whole you kind of word. I know I've used that a couple of times, right? But it does sum it up, right? Because we'd like to address
the emotional part of going into this, right? So I don't know of a patient that comes in who isn't nervous on the morning of surgery, right? And that's hard enough to deal with than to then be, needles and pinpricks, and you go into a cold room and there's all this stuff in there. So if we can make it more personal to you, if we can make it so that you feel that we're invested, that there is warmth and compassion genuinely, right, behind all of this, right, then that can help alleviate a little bit of that anxiety that's there. I always joke with my patients and I say, when you see me looking nervous, you should probably leave, right? and it's a true statement. If you see me looking nervous, you should probably leave, right? But you won't see that in us, right? Because this is what we do, the team, not just me, but the team, day in and day out. So we can be your rock, right? We can be that support system you need as you're rolling into the operating room. And that's our goal. That's our goal, to make it so that it's not you're coming in for a procedure, but you're coming in to change your life. And this is just one small step in that process.
Yeah. I always tell people that I don't know anybody that wasn't nervous going into it, but I don't know one person that regrets it after.
Right. Yeah.
And I really appreciate that you do keep mentioning whole person care, because we are so much more than our weight. With that being said, I was wondering, what comorbidities does bariatric surgery treat?
So the one that I always go to as my first is diabetes, right? Because it's such a big health concern and it's so difficult to treat, right? With the diet changes, with the medications, and if you have to be on insulin, it really does affect the quality of your life. And these operations can reverse it, make it go away entirely, right? And that's huge to me, because we haven't seen anything like that in medicine, right? So that metabolic component of it, I think, is the top thing. And then also coronary artery disease, high blood pressure, high cholesterol, infertility. As a woman, right, infertility, it's kind of high on my list of things to try to want to help other people with that want to have families, right? So that's something I think is great, because you have healthier pregnancies for both mom and baby, right? So those, I think, are the top things on my list that I always tell patients about.
I think that's so great that you emphasized that bariatric surgery can almost instantly help reverse these things. I struggle with insulin resistance. I had the black markings on my neck, and I had read that this surgery can help reverse it. And I thought, okay, I'm going to wait months, years. 3 days, it was gone. And I just thought, oh my gosh, I really did change my life. And it's in those moments where you think, yeah, I'm reading all of this. My surgeon told me this, but really, does it work? And to know and hear from a trusted source such as yourself or your AdventHealth provider, to know that that's a real effect of the surgery is very comforting.
Yeah, I think it's exciting, everything that we continue to learn about bariatrics, that we keep adding procedures, medications, just the overall treatment algorithm for obesity is changing, right? And I think that's only going to make it better and make patients more successful, because it is a journey and it's not just one step, right? And so it's a continuous treatment algorithm.
I appreciate that. Dr. Bachler, you just mentioned medications, and I was wondering, when would a patient consider onboarding an anti-obesity medication?
You can introduce medications at any point, right? And you have to think about what's right for you. So I have a number of patients that I have seen that have considered weight loss surgery, but maybe just aren't there yet and don't feel that they want to take that step. And so I would say, let's consider the medications. Why wouldn't we, right? And see how you do. And if you're able to lose the weight and keep it off, then great, right? I also have patients that have had surgery, and in their journey, they've lost weight, but maybe they're struggling, right? Maybe the disease of obesity, which, is still present, right, is still progressing despite the fact that you had surgery. So let's add an adjunct. Let's put medication in there too, right? I think you have to kind of look and see where you are in your personal journey, when you want to add that or use that. The one thing I worry about sometimes is that, the side effect is muscle wasting. So, you have to consider that. You have to include no matter what treatment you do, lifestyle changes, right? I don't think there's any one time point that you can say, this is the time that you do this or this. It's like anything else in life. It's every individual has to think about things on a personal level and see where they're at on their journey and what is most likely to help them at that time point.
I appreciate that message because I think a lot of patients, probably myself included, would think I have to wait to a certain point or I have to wait until maybe I'm experiencing regain or something for that to be an option for me. So I really appreciate that. It's at any point, day one, you could ask you about it.
Yeah, absolutely. And you may not want to implement it on day one because the surgery is doing that. But then now I know as your surgeon, okay, so your goal is to get as much weight loss as possible. I can kind of assume that if we're talking about that medication at that time. And obviously I would verify that, right? But then I see, okay, well, we've plateaued. And where are you at now? And do you still feel the same way you did as when you asked me about that, right? So I think it's important to kind of keep that in the back of your mind. Remember, you're there to treat the patient continuously, right? And so just keep that there and then reevaluate because we change how we feel,
Absolutely. So how do you support your patients in the process?
I try to be as available as possible. And so one of the things that I tell my patients after their initial consult is that you can always reach out to me before and after surgery, right? So it's not always easy for me to be the first point of contact because I am in the operating room. I am running between various hospitals, seeing patients. But all you have to do is tell my team that I need to talk to Dr. Baglu, and within 48 hours, I will get back to you, right? Whether it's a question that you forgot to ask me during the consult, something that has changed that you want to talk to me about, or maybe you just want a follow-up appointment with me because you haven't seen me in a while, right? All of that I think is very reasonable for a patient to want, and I want to make sure I'm there to support each patient in the way that's best for them.
I love it. So Dr. Cedarhall, who qualifies for bariatric surgery?
So traditionally, bariatric surgery has been offered to adults, but that paradigm has changed as the obesity epidemic has started to expand and affect our kids. So now you can qualify at the point of adolescence if obesity is a problem that's significantly impacting your health. And AdventHealth, we have physicians who specialize in both pediatric as well as adult bariatric medicine.
Nice.
That's wonderful. I was a pediatric patient, and that's so near and dear to my heart. So I love that AdventHealth does pediatric obesity medicine. It's really wonderful. So do AdventHealth providers work interchangeably? Non-bariatric providers, do you guys communicate with each other?
Absolutely. That's a great question. The paradigm has shifted. It's no longer just weight loss surgery like it was 20 years ago. We've come to realize that obesity in and of itself is its own disease process. And carrying extra weight is just one of the symptoms of that. But diabetes, high blood pressure, not just the physical manifestations that go with it, also the mental health aspect of it. So at AdventHealth, we've made that adjustment. And we've come into the new era where we're treating the whole person. So you do have cooperation between internists, endocrinologists, surgeons, mental health specialists, physical therapists, you name it, whatever is required to treat the whole person, that's what we aim for.
Well, and that's a good thing too, because a lot of times what we find is there's so many stopgaps in places. Like patients just want to get from one to the other, and it's very hard for them to do those things when they have extra appointments or one appointment doesn't line up with another appointment, then that sets them back some. Because there are different times in my process where it's the same way. So talking to the hundreds, if not thousands of patients that we've talked to, it kind of comes to always the same issue. There's always something that another hurdle they have to overcome. And just making the decision to have the surgery in the first place is hard enough on its own. Yeah. So you guys streamlining the process just makes it that much better. So.
Yeah,
absolutely.
And we are definitely more than just our procedure. So
absolutely,
the fact that AdventHealth is really focusing on the whole person is amazing. I really appreciate that as a patient.
Mm-hmm. Absolutely. So how and why does bariatric surgery work? Can you give us a little insight on the science and mechanics behind it?
Yeah, absolutely. So bariatric surgery, a lot of people think you're stapling the stomach, you're going to eat less, and that's why you're going to lose weight. And to a certain extent, that is part of the process. But over the years, we've come to realize that it's not just a matter of simple calories in, calories out. And a lot of people who have tried dieting can attest to that. If 70% of the population is overweight, there's no way 70% of Americans are indisciplined.
Yeah.
So when we started taking a deeper dive and we started to figure out the hormonal challenges associated with obesity causing a systemic inflammatory response that affects all the organ systems, then we were able to really start tailoring the care in a more effective way. Now, where the surgery comes in is it affects the hormone-producing cells in the gut, which a lot of them come from the stomach and the small intestine, which are affected when we do sleeves and bypasses and SADI-S and so on. The hormones that are produced affect our metabolism. So by doing the surgery, we kind of turn the dial on those hormones. It feeds back to the metabolic center, and it affects how our metabolism actually is wired. And that's why the surgery has such a great long-term effect, because it does it in a more permanent way. So, yeah, you're going to eat less. You're not going to feel hungry, but that is almost a side effect of the whole process.
That's amazing.
Yeah, it's interesting when you take a deep dive. You can get really deep into it.
Absolutely. I know as a patient, when I learned that the weight loss is the side effect of the surgery, I mean, we call it weight loss surgery.
Right.
It's really a metabolic surgery. I know the industry is kind of veering towards that path of calling it metabolic surgery. As a patient, to realize, oh, this is just a wonderful side effect and not the main reason, I think that has been really meaningful for me.
That's a great point, because there's so much stigma as well involved in calling it weight loss surgery, and it's not accurate. The extra weight, again, is just a symptom of the overall disease. So we're treating the underlying disease. And people qualify for surgery if they have bad diabetes, difficulty with blood pressure, a lot of other conditions. So that's why we've transitioned into whole health, bariatric care, metabolic surgery. So there's not that, hopefully move away from that stigma permanently.
We're learning, right, the importance of metabolic health. Why is diet and exercise still, it feels like it's being pushed on us still to this day? It's 2025, but why do you think that is? Is that the stigma? What's your take on it?
Well, there's two analogies I like to use when we talk about diet and exercise. One is building a house. That's the foundation. You can't build a house unless you put a solid foundation down. Diet and exercise, eating healthy, just having a healthy lifestyle. Even if you do surgery, if you take medications, if you do anything, if you don't have those things to build on, it's going to be very difficult to keep long-term success. You're not going to have that. The other is sports analogy, which appeals to some folks. If you want to play basketball, you want to play golf, you have to get the fundamentals down. Your swing, ball handling. If you don't have that, you can't do the fancy stuff. So diet and exercise we're moving away from this misconception that that's the only thing that's required, because people think, well, the surgery is a shortcut, or the medication is a shortcut, or if you do this or that, it's a shortcut. It's not. Diet and exercise for the majority of people will not be enough to meet your goals or to get over the disease. But without them, it's going to be very hard or almost impossible to sustain success after. So we're trying to put it in that context.
Makes total sense. It's kind of like the training wheels, right?
You give me a third analogy to add.
For the non-sports people in the room like myself. Having the training wheels. And that's something that at BariNation we've realized, and it's all a tool. They're all tools that we can acquire to carry on and have that lifelong success. Yeah. Absolutely.
So, how do people know what surgery is the right fit for them?
So that's a great question. And that's not a easy choice. It takes a lot of things into consideration. We're all different on the inside. Our chemistries are different. Our psychologies are different. And people get to the point of, the obesity or the conditions associated with obesity through different pathways. So you have to take that into consideration when choosing the right path. Consultation with a specialist or specialists in the area is the best place to start. You have to look at your personal health, what your weight loss goals are, how you got there, what your time period is for wanting to lose the weight, and other factors. And that keys into what would be the best pathway forward for you.
Gotcha. So you would say that's what people need to consider when they're deciding which surgery is best for them?
Yes. Yeah.
Okay. Awesome. And then, so when someone's trying to pick the best place for them, why would you suggest AdventHealth be the spot that they come to, aside from the fact that you work there?
Yeah. So I've been part of AdventHealth for over 5 years now. Proud member of AdventHealth. And first and foremost, I would say as a faith-based organization, they really do go beyond. They care about the patient. And a lot of places would say that, and you hear it a lot, but I've lived it, and I've been blessed to be a part of it. So I would say that's one of the biggest, I'm one of the biggest advocates for how they approach healthcare and patient care. Beyond that, AdventHealth as well is extensive in the resources we offer. So apart from having well-trained specialists in surgery and internal medicine and mental health and physical therapy, all the things that are required for success with a weight loss journey. We also have extensive infrastructure and facilities throughout the Central Florida area, all of them state-of-the-art. We're fully accredited with all of the appropriate, and we're proud of that. We maintain that quality. And, it's just a pleasant experience when you walk in through that front door. We try to make it that way because we understand that, it's difficult as a patient, one, to make the decision, and then to have to follow through all the steps that are, inevitable. So we try to make that process as easy, as effective, and at the end of the day, as fulfilling as we possibly can.
Right. Well, one of the things that I like to try to explain to people when they're choosing, where to go, is that obtaining a center of excellence is not something that's easy to do or to maintain.
Correct. Yeah.
So that's one of the biggest things I try to explain to people, is just letting them know, like, when you're looking, this is something that's extremely important.
Yeah.
Because it speaks not only to the care that you're going to get pre-op, but also post-op and the follow-up and those types of things. So if you had to sum up the AdventHealth difference, what would you say that is?
Well, all our facilities are accredited or center of excellence. We maintain that, and it's very, very stringent. It's, not just a hospital, but the providers, all the staff involved are trained and maintain that standard of care. So we stand by that, and that makes a huge difference. We report our outcomes. We keep up to date on the latest data and science, as well as technologies.
So Dr. Steedall, you mentioned comorbidities a little while ago, and what comorbidities can be treated through bariatric surgery?
So that's a great question. The ones that immediately come to mind are high blood pressure, diabetes, and sleep apnea. The reason those first three off the top of my head is because they have over 90 to 95% success in terms of improvement or sometimes complete resolution, starting within the first couple of weeks after surgery. So we've seen patients come off of insulin, get down to pills, or have their diabetes cured completely, let go of their CPAP machines within, the first month after surgery, come off of their high blood pressure medication. Not just a matter of coming off the meds, but those things can cause numerous side effects down the road with kidney disease, eye disease, heart disease. So those are the big three. But beyond that, physically, as we've done more research and we've taken a deeper dive into the disease of obesity, you find that you have other effects in other systems. So taking the inflammation away reduces, overall incidence of lung disease, stress on the joints and back, arthritis, those types of things. And there are also several types of cancers that have been associated with obesity that are improved, things like breast cancer and colon cancer.
Wow. So it's not just improving someone's quality of life. I mean, this procedure can really extend somebody's life.
Yeah, it absolutely adds years to your life. It's one of the most effective things you can do to take back control. when things feel like they're spiraling out of your control, it helps you to regain that agency.
Yeah, that is just incredible. I know you mentioned medications also when you're talking about the different types of treatments that are available. So when would someone consider onboarding an anti-obesity medication?
Yeah, that's a great question. So we're seeing a lot of that now with the recent popularity of these medications, and they absolutely are effective, and they play a huge role in the overall path. Like everything else, they have advantages, disadvantages, just like surgery does. And it goes back to what we were talking about earlier, where every individual is a little bit different. And depending on what their weight loss goals are, what their health profile is, other factors as well to consider, practical factors like insurance coverage and costs associated with whichever path they may want to take. These are all factors we would have to consider in choosing the best treatment plan.
Mm-hmm. Okay. And the anti-obesity medication, can that be used as an adjunct treatment, like post-bariatric surgery?
Absolutely. Yeah. My personal opinion is it's a holistic approach. So diet, exercise, sometimes surgery, sometimes medication, usually a combination of two over time is the best way. Once you have a tool, there's no reason to say, I'm only going to use this one. Use each one when appropriate to get the desired response or effect. So we try to integrate everything that's available and that was shown to be effective and safe into a complete health package tailored to each individual who we treat.
I love that. That's that whole person care coming back again.
Yeah.
Well, and it's hard because a lot of people feel like, it should be a one shot done.
Right.
And it's very hard to get out of that mindset because we think that, as obese patients, like we think that and like this is our only shot. Like we're going to do this. It's going to be great. And this is just going to fix all the things.
Yeah.
And then, whether it be, reflux or, weight reoccurrence or any of those things that may come along, it's very hard to get people out of that mindset to say, I need to onboard other additional treatment without feeling like they have failed in some way, shape, or form.
Yeah.
So it's good to have these conversations come out and be at the forefront because it really makes a difference in people's lives.
That's a great point. Yeah, it's absolutely a great way to summarize it.
So how do you support your patients through this process?
So we begin by having a face-to-face. So we get their health information. I always meet my patients on the first visit. We sit down, we chat, we talk about them, their health, their journey in trying to lose weight. We talk about where they see themselves or what they want to get out of this whole process, because that really will dictate how we move forward. Then we kind of discuss a plan forward. Have a contingency plan as well. So, okay, let's aim for this. If not, let's do this. And it's always an algorithm, but I think it starts with having that personal interaction so you can get to know each other. So not just me getting to know them, so they're getting to know me so they can trust that I have their best interests at heart.
That trust is so integral to the patient perspective and the patient experience. It really does, again, speaking to the foundation, right, of I will be with you throughout the entirety of this process, lifelong. You're sealing the deal in a way, like upfront, which is, I think, just priceless for a lot of patients.
No, I appreciate that. We've come to realize that too, and as you said, we're bonded for life once we establish. That scares some people off sometimes, maybe, but I tell them even after surgery, I like to tell my patients, surgery is not the point of this whole thing. The point is to get you healthy and keep you happy and where you want to be. And surgery is part of that sometimes. So us seeing each other today is not to get to surgery, but surgery is the middle point of your journey or a path along. And if you look at it like that, and even afterwards, we're going to, maintain, we're going to troubleshoot, we're going to, deal with the challenges that life will inevitably present. If you get into that mindset, then it's easier, and you get away from thinking it's just a one stop. And if it doesn't work, then I've failed, or, something went wrong and I have no other recourse. It's very, very rare that it's a one shot for anybody. That's usually the crazy exception more than the rule.
Well, it's, you speak to, like Natalie said, the lifelong, and a lot of people think, we put this time constraint. Oh, it's a 6 month, after my 6 month checkup, then I only have to go once a year. Or then after that year, then I can't talk to him anymore because I'm done. I've hit my 1 year mark and I should be able to do this on my own. I don't need any further communication unless I do another follow-up at my 2 year mark or whatever. And really getting people comfortable with understanding that this is a constant communication situation. Anytime you have questions, anytime you need anything, people should be able to reach out to their teams. And that's something that's really starting to develop more as we come along and talk to more patients and more, programs, especially with AdventHealth. You guys are really great about making sure that constant communication is important and imperative, and people know that they have that option. So I really appreciate what you guys are doing with that.
In 2025, we're asking all of our guests, what are your bold predictions for the future of obesity medicine in 2025 and beyond?
Well, so that criteria expansion, right? So I think that is very exciting that it's already started. And thankfully, we're starting to see some insurance companies kind of expand what they're willing to include in their coverages. So I see that growing because I see our data becoming more and more robust and showing that this works. It's the most effective treatment option. And it's really what helps patients kind of achieve that weight loss and resolve their comorbidities. I do see the medication staying. And even becoming more in use. So same thing, expansion of criteria. Because I think that, obesity is seen now as the epidemic that it has been, but that the conversation is evolving. And that's going to allow us to be able to do that multimodal kind of approach to it. I know with our Whole You experience, we are trying to create a center where you could go to and have all of the various parts of obesity management in one location so that it makes it convenient and easy to access. And so I see that kind of expansion of care, that ease of access, is really where we're going to be headed.
Yeah. That would be amazing to have that treatment all in one, one location, because a lot of times you do end up driving all over town. So
right.
I love that AdventHealth is really considering what it's like for us as patients and really trying to create an environment that is convenient as well as, comforting and supportive. So.
Yes.
Well, and the support of the multimodal is important too, because like so many times we think this is the last stop, like we have the surgery and that's all we can do. There's nothing else left, like even as to the point of revisional, like revisional even has, is finally now the stigma is starting to lift a little bit on that.
Right.
And it's good to see that it's being supported by AdventHealth in that way. So,
yeah, I mean, I think even amongst medical professionals, we're starting to realize, look, this is a chronic disease. It's no different than Crohn's disease, right? And it needs ongoing care, continual reevaluation of where you're at, and then what else can we do, right? So that, we can meet that ultimate goal of giving patients quality and quantity of life.
It's exciting to think about where we're going to be because for me, this journey towards being a bariatric surgeon has been almost 20 years. It's something since medical school I always thought. So to see the landscape change over that time has been incredible. And I never thought we would be here in my lifetime where we have all these facilities available, all these things. So the way technology is improving, I wouldn't venture into what new breakthroughs are around the corner. Mm-hmm. What I would like to see, or what I know we're working towards, is integrating towards a more whole you approach to really round out the edges. So we talk about surgery and medicine and diet and exercise, but what about mental health? What about that aspect of it? What about the pharmaceuticals, the access to the healthy food? Telling people to eat healthy is great, but that's like telling them to lose weight and come back. It's ineffective. How can we facilitate that? Partner in the community with providers that can get you access to proper foods, get away from the food deserts, partner with providers who can offer exercise options for people of all, the whole spectrum, from the very athletic to those with possibly disabilities and everything in between. So I think what I'd like to see in 2025 is us fulfill our obligation to the community in being able to offer that. and then really just be good stewards of the community health in being able to get people through that journey and give them options. If we can do that, I think we've taken a huge step forward.
Absolutely. I know for myself, I've been thinking a lot about the patient experience with BariNation. How can we support the patients? And I'm seeing, as we're speaking more with providers such as yourself, we're seeing it start to shift to be patient-centric. I think that is where I would love to see more. Let's talk to the patient first, as you said, and tailor their treatment to the patient individually. So that's my prediction. That's my bold hope for the next year or so.
Yeah. I think for me, what I would love to see, well, I liked that you've talked about whole person care throughout this whole conversation. And then you also mentioned a little earlier the move away from weight loss surgery towards a metabolic surgery. And as a patient that had comorbidities at the time and really needed the metabolic portion, metabolic changes, I hope to see that continue to, catch on, and for even people that are not part of the field to really understand that this is a metabolic procedure.
Yeah.
Mm-hmm.
I know for myself, it's really more just pushing forward. We're more than our diagnosis. We're more than just the weight. We're more than, because so many people that we speak to, so many patients, that's that, I could have had this fixed, but they just said it was just because of my weight. If I just lost weight, this would be better. If I just lost weight, and you come to find out like there was a host of things that could have been, that could have been diagnosed and fixed without the weight. Like the weight loss, of course, exacerbates those things, but we are more than just the diagnosis of obesity. And the fact that, everything is becoming more patient-centric is just amazing to me. I love seeing it. I love pushing forward. And my bold prediction is we're going to do a whole lot more with AdventHealth and BariNation, and I'm excited for that.
Yeah.
That would be wonderful, yeah.
We would love that. Well, thank you so much, Dr. Sadahal, for your time, your expertise. We really appreciated it, and I know our listeners will too.
Thanks for having me. I appreciate it. Thank you.
Thank you.
That wraps up another empowering episode of the BariNation podcast. If you enjoyed today's episode, keep the conversation going by joining the BariNation membership community, where you can attend live support events, access on-demand resources, and find a caring community.
Join us at barination.mn.co. If you found this podcast valuable, help us produce it by becoming a $5 monthly supporter at barinationpodcast.com.
And just remember, at the end of the day, you've got this, we've got you, and we'll see you next time. Bye, everybody.